Alright, I'm Jonathan. This is my knee trigger. I have just got a knee rec from the printer. So I check my name and date of birth over here on my rec. I come to the computer, I scan it up, and I see that everything kind of lines up here with what I've got here. I'm going to be examining a knee. I'm going to be doing 5 views. It says 3+ views on here. I'm going to do 5. I'm going to do AP, an internal oblique, a lateral, an intercondylar fossa, and a patella. So, I look at my paper, I look at my exams on the computer, everything lines up. So this part is ready to go. So I'm going to grab my films. So I've got 4 films. The 4 10x12s for all of my views except for the patella, which will be on 8x10. So I head into my room, and I'm going to set my room up. So my first couple pictures are going to be using the Bucky, so that's going to be a fairly high technique. I'm going to set it at probably about 70 at 8 to 10. This is going to be for my AP and my oblique. So the next thing I'm going to do is I'm going to take one of my 10x12s, bring it into the room, place it into the Bucky, lengthwise, portrait-wise also, aka, and I'm going to line up my tube with my Bucky. So here we go. Make sure the tube is perpendicular for now, until I find out more about my patient. It's detented transversely, and I use my trusty laser beam here to make sure that my film is lined up with my tube. So that is ready to go. I'm going to go ahead and move the bed all the way this way so my patient can sit down in the middle, and then I'll move them over and get ready to look at their knee. So, room is set up, technique is set, film is in place. I'm going to go get my patient. Tanisha?
Hi.
Hi, my name's Jonathan. You doing all right today?
Yeah.
All right. Well, you're here, so thank you. But what's happening?
So I fell on my right knee the other day, and it's been hurting ever
Okay.
since. So I'm
Okay.
definitely want to come in.
All right. So we're going to take a look at your knee today. That
Okay.
makes sense.
This is my
All
doctor's
right.
orders.
All right. All right. And Tanisha, what's your last name?
Tavares.
All right. And your date of birth?
6592.
All right. And any possibility you may be pregnant?
No, definitely not.
Okay. All right. So I'm looking right at my 2 orders here, what I've got from the doctor, what I've got from the office. It matches up. 5 views of the knees, what I'm going to do. So I'm going to set these to the side for right now. And Tanisha, in order to look at your knee, I'm going to go ahead and have you put on a gown and remove your pants. So,
Okay.
It'll fit on like this. It's going to cover your front. It'll be open in the back. I will hand this to you.
Thank you.
I'm going to step out for a minute, give you some privacy,
All
and
right,
let you
cool.
dress.
Thank you.
All right? Let me know when you're ready. I'll be right outside.
Okay. I'm ready.
All right. All right, so here we go. I'm going to have you sit right here and then lie down with your head on that side.
Okay, I can do that.
Oh, sorry. A little high there.
It's all good.
Okay. All right. And it's your right knee, correct?
Mhm.
Okay. All right. So, I'm going to look at where my light field is. I'm going to get ready to position Tanisha for the AP knee. So I'm just going to move the gown a little bit here just so we see the knee, and I'm also going to grab a shield for you. Okay. So I'm just going to lay this on top of you.
Alright, thank you.
Yeah, absolutely.
Definitely want to have kids.
All right, so this shield is important. Excellent. All right, so where I want my central ray to enter for this shot is about ½ an inch below the patellar apex. So I put my crosshairs right there. And Tanisha, can I have you take your toes directly up toward the ceiling? Good. Foot is completely vertical. So I make a small adjustment here with that movement of the leg. Once again, we're set up for the AP. I'm going to cone in a little bit this way. All right. And I've got my right marker here. Bless you.
Oh, I'm
Bless
sorry.
You. Not a problem. Not
I
a
have
problem.
really bad allergies.
You're good. I mean, that's not good, but no problem with you sneezing. Okay, here we go. So we are ready to go. Just hold that right there. I'm going to come over here and shoot. Beep. All right. I take my next film. I trade out the film that I just used. Put the next one in portrait-wise. And I'm going to put my dirty film over here so it will be separate. Actually, I'll probably put it here so I won't get any radiation on it. All right, so the oblique is going to be pretty much the same as the AP in every respect, except that it's going to be rotated a little bit. Now, of course, I want to check to make sure that her as-is, what her as-is to tabletop measurement is, which I should have done before I took the AP. And in order to do that, I can use my little measuring tape here, and I can see that she's in the 20 centimeter range, which means if she's anywhere between 19 and 24 centimeters from as-is to table, then I can use a perpendicular central ray for her knee. If she were less than that range, then I would use a 3 to 5 degree caudad angle. If she were more than that range, I would use a 3 to 5 degree cephalic angle. And I would do that for both the AP and the oblique. So, it was appropriate to use the perpendicular beam for the AP, and I'm going to do that as well for the oblique. Alright, so Tanisha,
Yeah.
from right here, can I have you log roll your whole leg inward? Yeah, so from the hip. There we go. There we go, alright. And the leg is straight, excellent. And can I have you come back towards me just a little? Perfect, right there. Alright, once again, the central ray is entering at the same place, about 1/2 inch below the patellar apex. I'm going to cone in a little bit. We're pretty lined up there. I've got my marker in place. Alright, hold that right there. You're doing great, Tanisha. Beep. Same technique for that shot. So the first two were both 70-ish kVp at 8 to 10-ish max. So actually, what I'm going to do now is I'm going to remove this one from the bucky. Excellent. Go ahead and relax for a moment. I've got my next film here. I'm going to take my intercondylar fossa view here. So I'll go ahead and grab my marker real quick. Alright. I'm going to want to build up the IR a little bit. So can I have you bend your knee up toward my hand? And there we go. Excellent. I'm going to stick this plate underneath you. It's a little cold. Sorry about that. Alright. And I'm going to need to change this to tabletop. And I will need to also change my technique in a moment. So I'm going to angle the tube just so that it matches the angle of the tib fib there. Alright, I'm going to move you a little bit towards me. Alright, can I have you bring your heel a little bit more towards the wall, Tanisha? So the knee can stay where it is. You're great. Just pick up that heel of the foot, whole foot, and bring it over that way. Up and over, just a little. Perfect. There we go. Alright. So I want my central ray here, which is perpendicular, making a right angle with the lower leg, to enter about the same place, about 1/2 inch below the patellar apex. So I've got my plate right here, and I want to make sure that it's up far enough that as the light, as the picture kind of casts the, bless you, as the picture is cast this way on the film, that I have enough film that's going to capture the whole intercondylar fossa. So I'm going to pick up my marker, which I dropped over there, make sure that it's within the light field. Bless you.
Thank you.
Make a small change here. Coming out just a little bit more. And I'm going to make a small adjustment on the shield here to make sure that we are covering everything that we need to cover. Bless you, bless you, bless you.
Just ignore me, it's okay.
Alright. Alright. So I think we're pretty good to go with our positioning there. I'm going to change my technique. I'm going to bring it down a little since we're not in the bucky anymore, and I'm going to make it probably 70-ish kVp at around maybe 4 mass. So, before I leave, bless you, I switch to tabletop here. Beep. All right, so we got that one. Next, that was the Claire method that we just did. And next we're going to do the Setagast method, also called the sunrise, to get the patella. So I will move my box over here. All right, Tanisha, once again, can I have you bring your knee up toward my hand in the amount that you can? You doing all right?
Yeah.
Okay, all right. I know that's not real comfortable. Can I have you hold this so that it's about right here? Okay. All right. So I have Tanisha holding the cassette. What I may do is move her down towards me a little. All right. And I'm going to be angling the tube upward a little bit and bringing it down low enough that it's going to come up to the knee. So, I have probably a little too much of an angle there. There we go. And I'm going to change this. Alright. Is it possible to flex the knee any amount more, to bring it up any amount higher?
Sure, yeah.
Okay, perfect. Alright, there we go. Alright. So for this view, I ideally want the patella to be perpendicular to the IR. And my central ray is going to enter right in the patellofemoral joint. There we go. Alright, so my crosshairs are right there around the patellofemoral joint. And take my marker and stick it in there. My tape isn't really working right now, so we're just going to say that it's stuck and it's right there in the light field. I don't need the light field to be very big. I just am getting a very specific joint here. I don't need a whole lot of light. So, we've got that. And again, we're at about 70 kVp at 4 mass here, 4 to 5 mass. Beep. All right. So I go ahead and take this cassette. I'll put it with my other dirty cassettes. And this one we are once again going to do in the bucky. We're going to do our lateral right now. Alright. So once again I'm going to need to make sure that tube and bucky are lined up. So tube and bucky are lined up. My tube is also detented transversely, so that's good. I've got about 40 inches SID. Alright, and actually, I think we're good there. Tanisha, can I have you roll onto your right side? So you're going to roll towards me, and you're going to bring your left knee closer to me. Good. Alright. And so the right knee is the one that we're taking a picture of. Can I have you bend the knee just a little bit more? Perfect. All right. So we want this knee, the affected knee, to be bent about 20 to 30 degrees. All right. All right. And I've run out of ability to move the table, so I'm going to move Tanisha a little bit this way. Here we go. I'm going to need to put about a 5 to 7 degree angle cephalic on the tube to make sure that I account for the fact that the medial epicondyle is a little bit lower than the lateral. And I'm going to open up a little bit to get some of the fiber and some of the tib fib in there. And my marker I will also place here on the film. And I'm changing to tabletop once again. It's a little heavy, isn't it? It's kind of warm. Alright, there we go. Alright, I'm going to make a small shift in the shield here. Alright, hang in there. We're almost done. Alright, can you bring your heel towards me a little bit? This whole foot. This one here. Yeah, good, good, good. Excellent. Alright, so I want my central ray to enter about 1 inch distal to the medial condyle of the knee. I've got my tube ankle on there. We are ready to go. So I'm going to come over here. Once again, change my console to tabletop. I'm going to set my technique at about 70 at 8, maybe 9 or 10 for the mass. Probably more like 9-ish. And we're ready to shoot. Beep. Alright. So Tanisha, go ahead and relax in whatever position is the most comfortable for you. I'm going to go ahead and take a look at the images, see if we've got all the anatomy that we need, and I will be right back.
Alright, sounds good. Thank you.
Okay. So I take all 5 of my films. I come back to the computer where I've already pulled up Tanisha's name. I scan one, stick it in a reader. I scan another, and I stick it in a different reader. I scan another, and stick it in this reader. And I wait for all those 3 to load, and when another reader is available, I'll pull out one, I'll pull out another, I'll scan the last 2, and stick them in readers. So all of my 5 images have come up. I take a look at them. I can see that the positioning looks good. I have all the anatomy that I need. I don't need to take any repeats, thankfully. So I'm ready to let Tanisha go. Alright, we've got all the pictures that we need. How are you doing?
Awesome. I'm good.
Alright, you did great. Thank you.
Cool.
So I'll take this. Alright, and I will go ahead and step out and allow you to change back into your clothing.
Good.
Alright, thank you, Tanisha. So when Tanisha is dressed again in her clothing, I would probably come back into the room and show her out. Make sure she knows how to get out of here.
I do.
Thanks again. Alright, and that's it. So I've just sent Tanisha on her way. So I looked at the pictures before she left to make sure that I didn't need to repeat any of them. And I don't. I have what I need to have in the pictures, so I'm just going to go over what criteria it is that I need to see. So this is the AP projection of the knee. The main things that I want to see in this picture are that I don't have any rotation to either side. And one way that I can assess that is to see that the condyles of the femur, the distal condyles of the femur, are more or less symmetrical. Also, I can look at the intercondylar eminence and see that it's in the middle and it's centered in the image. And so that all looks pretty good. Also, I want to see that this femorotibial joint is pretty well open. So I can see there's a lot of space in there. So it's a pretty good AP image. For the AP oblique knee with internal rotation, the 2 main things that I'm looking for are to see that there is a pretty good opening here between the tibiofibular articulation, the proximal tibiofibular articulation. That could be a little bit more open right there, but it's not worth repeating. Tanisha's young, and this is a good enough picture to send to the radiologist for the knee pain that she's having. Also, I want to see that the patella is a little bit further out than the medial condyle of the femur. So it's a little bit that way, so that's a pretty good internal rotation. For the intercondylar fossa, the main thing I want to see, of course, is the intercondylar fossa. So here I see that that's nice and open. I want to make sure that the patella is not overlapping or covering the intercondylar fossa there, and I want to be able to see also the intercondylar eminence on the tibia. So that all looks open and looks pretty good, so I'm ready to continue on. And this is the sunrise, otherwise known as the Settegast method. The main thing I want to see here is a good opening in this patellofemoral joint. So I want to make sure that I can see all of this space here and that I see the profile of the patella. So that's all open, that looks pretty good. So Tanisha's on her way, so I will send the pictures over to the doctor, and the doctor can take a look at him, see what he says, and touch base with Tanisha. So there's that.
Off now? Or do I just push that?